Good afternoon. I'm Dana Parsons, Vice President and Legislative Counsel with Leading Age Virginia, and I appreciate the opportunity to provide an update to you for the week 3 of the General Assembly session. Along with our lobbying team Spots Fane, we've been very busy this week reviewing legislation that's recently been filed. As of January 17th, that was the deadline for filing legislation, and therefore bills have exceeded to about 3,100 bills. We do expect many more to be posted as the Division of Legislative Services is working very diligently to get those bills posted. So I would like to provide you with an update on some of the key bills that we're tracking this week. I'm very excited to let you know that Senator Louise Lucas, Senator Siobhan Dunnavant, and Delegate Chris Hurst have introduced budget amendments to the governor's budget to increase the adult day Medicaid reimbursement rate to $97 a day. The current rate is approximately $57.04 per day and is just not enough to care for participants in this adult day setting. So we're very pleased, and we're asking you if you would please help us with our advocacy. We have alerts that are included in our weekly newsletter and on our Facebook page, where you can go and click on and determine if one of your representatives serves on a budget committee in the Senate or the House. If so, you complete this message and hit send. It's just that easy. It would be great if you could really help us. They need to hear from you, and this is a very important area within the continuum of aging services that needs funding. Regarding nursing homes, we have 2 staffing ratio bills that have been introduced. They are not likely to pass due to the fiscal impact, but we are monitoring those. I'm excited to let you know that there's a bill that's been introduced regarding pre-admission screening processes for nursing homes that's going to streamline some of the requirements that DMAS has in place to make it easier for nursing homes. There's also many bills that have been introduced regarding the Certificate of Public Need. We ask that you please check out our legislative tracker that's available in our weekly update on Fridays. All of those bills are there. They're just too many at this time to go over, but they're all amending the COPN program in some way. Regarding assisted living, we have 2 bills, as I had mentioned last week, that provide for electronic monitoring of resident rooms. Now, this legislation will require the Department of Social Services to develop regulations that will enable assisted living facilities to voluntarily allow electronic monitoring of resident rooms. So we're working with the patrons of these bills to ensure that this legislation is exactly the same as the nursing home legislation that went through several years ago that allows monitoring to be a voluntary option for providers in Virginia. So at a minimum, providers would be required to have a policy as to whether they permit the monitoring. If they do permit it, then regulations would be activated that would allow them to have a community managed system or a resident managed system. But assisted livings would have the option to not permit the monitoring. For both assisted living and nursing homes, there has been legislation introduced that creates an affirmative defense for staff to store and administer CBD oil-based products to residents who have lawfully received written certification from their physician and also registered with the Board of Pharmacy. We continue to work with CMS to get guidance on this so that we can make sure that the proper legislation moves forward that will be in compliance with regulations. We also, regarding independent living, as I had mentioned last week, we had legislation introduced that creates a community ombudsman's office for independent living within the Department of Aging and Rehabilitative Services. As of last week in subcommittee, that legislation was recommended to be stricken from the docket. So therefore, when it goes before full committee, we expect that to be stricken. There are many bills that have been introduced regarding minimum wage. Leading Age Virginia is working with other healthcare associations to develop a joint statement regarding minimum wage and the need to also increase all levels of reimbursement if an increase in minimum wage were to move forward. We will have that statement available for you shortly in our weekly update. But you can track all these bills, the minimum wage bills, and all of the bills that we are tracking in our 2020 General Assembly Legislative Tracker, which will be included in our weekly update on each Friday. So thanks so much. I hope you will tune back in next week for an update on week 4. Thank you.